Ocala's information station, 1370 WOCA.
Ocala.
All right, 5 minutes after 11 o'clock. Thank you for listening and for putting up with my voice today. I'm not so sure. Maybe I like it this way. Maybe it actually sounds better on the air. I don't know. We are going to speak to Dr. Ivan Levinrad right now. He's with Renee Genther. He and she are guests of Leah Caruso. Leah comes in and helps us out with guests now and then to talk about our health. Leah is from Strive Rehabilitation. Do I just say that? Do I say health or anything? Just Strive Rehabilitation, right? And Dr. Ivan Levinrad has been with us before. He's a doctor of physical therapy at Strive. And Renee Genther is an oncology patient navigator at Ocala Health. So you must be the one who helps us figure out what's next when we get that scary news that we've got the worst disease that mankind has ever known other than Ebola.
I knew that was going to come up.
You know, so Renee and Dr. Levinrad, good to see you again, Doctor, and good to see you, Renee. Nice to meet you.
Thank you. Appreciate it.
So, am I right that what you do, Renee?
Yeah, I'm an oncology nurse practitioner, and I navigate patients basically through the cancer continuum for life.
So, for life?
Mm-hmm.
So
Really?
you start at the beginning?
I start at the beginning,
diagnosed?
and officially, probably in December, we're aiming for to bring in the survivorship clinic as well.
What does that mean, survivorship clinic?
Survivorship clinics basically help patients navigate once they get through the cancer treatments and processes. And that way, they actually have a plan for the next few years, at least 5 years usually, for follow-up with their oncologist, follow-up with their primary care doctor. If they have any conditions existing after treatment, such as neuropathies, nutritional deficits, I actually get them locked into services. As a nurse practitioner, I'm able to do that and get them into services in the community so that they can actually go back to get their new normal of life and start, thriving again and moving forward with life.
Doctor, that makes me wonder if we never really get cured of cancer. Is that true?
Well, I'm going to leave you to answer that question. But from my perspective, I would say the answer is in many cases, yes, you can. But you've got to try get back to your prior level of function. And that's where I come in from the physical therapy perspective, helping guide these patients to prevent muscle wasting, get back to their normal daily level of function, and even surpass that. Exercise can be done at any stage of your life with most diseases, if not all diseases, really. It just depends how you tailor the exercises.
Okay. So somebody like Robin's husband, who lost one lung to cancer, is now considered cancer-free. But obviously, well, no, maybe not obviously. Maybe you're going to disagree with me. It seems obvious he wouldn't be able to jog anymore. Am I right?
True. Mm-hmm. Not true.
Not true, okay.
He can jog. He might not be in the Olympic team and run a 6-minute mile pace, but he can go out there and walk and jog at a very comfortable level as long as he's using his common sense and he's getting some reasonable guidelines. But really the limitation is none. It's zero.
Okay, Renee, we just had an author who was talking about conspiracy theories. You must hear your share of people who've heard, oh, here's a way to cure cancer, or here's a way to fix what's wrong because of cancer, and that probably has no truth to it, right? You hear a lot of those?
I do hear that a lot, and a lot of times it's really after patients are first diagnosed, and there's that shock and the denial process goes on. I think the conspiracy theory is out there. There's nothing you can do about it, but the reality is none of us want to see cancer. I have to walk patients from the time that they're suspected with cancer all the way to the time when they are diagnosed with the cancer, and then get them into care. That's the first part of my job as a navigator. And so my job is to get them through these processes quickly with knowledge. And I do say a prayer all the way along the way that it comes back negative, to be honest with you, because I don't want anybody to be diagnosed with cancer.
Right.
And I do have patients that we go in thinking, oh my gosh, we have cancer. And then once we get through the pathology and the tissue diagnosis, we indeed don't have cancer.
Oh, wow.
And so we can change veins, and I get them into the care they need to be. And then when they do have a cancer diagnosis, I find out where they need to be. Do they need to see a medical oncologist, a radiation oncologist? Is it surgically resectable? When we talked about the lung, that's surgical resection is always the best chance for cure. And we want cure. We really want to aim for that curative process for these patients. And if I don't know anybody who works in oncology that would want to believe that we know that there's a cure and we're hiding it. I've lost friends to cancer. We've lost oncologists to cancer. Believe me, if they knew there was something out there, they'd be using it. So,
Yeah, they would.
so that just kind of debunks it right there.
How about the cancer patients? They are diagnosed with cancer, and then they have to go through the different levels of treatment when they're at the different stage level. Are you there from beginning to all of the different levels? Because that is so scary when you're diagnosed with stage 4, and then the treatments have to be increased.
What happens is, depending on what their stage is and what they require, what I normally do, because we have a little bit of a fragmented community as far as how the cancer care is given, because all of our oncologists, radiation and medical oncology are outpatient processes. What I'll do is I'll get them in with care with these physicians. I can even go to an appointment with them if needed. If they don't, especially if they're going alone, I like to go with these patients to make sure they understand what's going on. And then once they're locked into care, they're usually the oncology in Ocala is really top notch. These places actually do a very good job of taking care of these folks, and
They're outstanding.
They're outstanding, and they have a lot of supportive care services in these clinics as well. So once they're established with their medical oncologist and radiation oncologist, I really am not involved unless the patient seeks me out, which some of them do, and I help as much as I can. And then once again, we're hoping to, at the end now, start helping them with that survivorship component and the supportive care part, where we can get them back to that new normal he's talking about. Patients need to know they can exercise. Patients need to know that if they're having depression after cancer, they can get care. They need to know that if they're not getting back to the normal as far as weight, that they can get help. So, we're trying to cover all of those bases. But yeah, definitely going through the stages of care, especially that initial few weeks of after diagnosis, is probably when I have my most hands-on time. And people always say I do so much, but all I really do is give them information. And build them
that
up
is so much so that
and
you don't
advocate
realize.
for them,
You don't
yeah.
realize.
But it is important.
My mom had breast cancer maybe 20 or 30 years before she died. And she was a survivor, in other words, for 25 years, let's say. I don't know the exact number.
You're a survivor the day you're diagnosed.
Okay, I like that. I like that. That's a good philosophy.
And I call everybody a thriver.
But let me tell you what happened at the end.
Interesting.
Let me tell you what happened at the end. It was after my father died. She had gone through a few cancer treatments in her life, and she was once again diagnosed with cancer of the liver, I think, or pancreas, something like that.
Yeah,
Right? I'm not sure.
pancreas.
She decided, I don't want to deal with it. I don't want chemo. I don't want radiation. Doctor said that means you're going to die. And she was 80-something,
84.
84. And so, probably knows my own mother's age better than I do. But anyway, that was her decision. So do you have that happen a lot with you? Where?
I do, and people often think that if somebody doesn't do anything, if they don't fight, that there's some type of a failure in that. And I like to meet patients where they're at, and I like to give them all the information that they need to make an educated decision. And the decisions for treatment of cancer, can be, I don't want to do anything. I want to live off the last part of my life as a quality of life. Some cancers are not curable. And if that's the case, then I support them there. I get them into care with palliative care and services that's going to support them through that process. Because sometimes no treatment at all can actually be a big victory. Because sometimes treatments, especially if somebody is elderly or frail, sometimes the treatments can just be too harsh.
Well,
So there's a balance.
Just going back to your own statement, that kind of undermined the importance of what you do. I want to make sure you know it's very important. It was hugely important for my mom, for my family, to have somebody who we could go to and say, what do we do now? What's the next person or next place or next thing we should do?
Yeah.
And it might be exercise. It might be walking every day, like you keep telling me to do.
Yeah, might be.
Every time I see you, have you still walk?
Physical therapy is so important for all of our patients, no matter where they're at. We have patients in the hospital right now that have diagnoses that have caused their legs to swell up before the treatment started, and so
Right.
their ability to get around has been really altered. The physical therapists are key in getting those patients moving while they're getting even started on treatment.
What do you do, doctor, to get them motivated? What's the psychological?
I tell you, one of the, and it's tough sometimes. It depends on the patient where they're at mentally, but just to show the patient that they can actually get out of bed and maybe walk from a bed to a chair is a good start. And then you can build up on that.
Right.
They're painful, they're fatigued, they might be nauseous, they're feeling weak. It depends, of course, at what stage they're at with their treatment as well. So you've got to take all these things into consideration. But just to show them and to be positive with them that, hey, you can do it, we can get you moving, then you start building up on that. Some people, it might be more aggressive and they are able to do that. Some people, it might just be from the bed to the chair. Working in the hospital, we see a lot of that. But there are a lot of people that are functional, they're out there at home, but they need to get healthier, build up their muscle strength and so on.
We have to take a little break, so I forgot last time, didn't I? So I better not forget this time. All right, we got to take a little break, and we'll be right back. By the way, the phone lines are open, correct? We're doing phone calls?
Yes.
You want phone calls? Okay. So if you have a question, this is a great time to call 622-WOCA, 622-9622. We'll be right back.
This many cars. It's OcalaForSale.com. Say goodbye to sticker shock. OcalaForSale.com has thousands of vehicles with no stickers at all. But hurry, don't walk, don't run. Just sit down and log on to OcalaForSale.com. Prices and inventory change daily. Offer does not include dealer upcharge. Undercutting, less proofing, factory surcharge, or delivery fee. See website for details.
The weather is brought to you by MyFWC.com. Safe boating is no accident. Sunshine today and quite pleasant with lower humidity, the high 79 to 83. Tonight will be clear and cool with lows ranging from the mid-50s and a few inland spots to about 61 at the coast. Mostly sunny and delightful tomorrow, the high 78 to 82. On Saturday, plenty of sunshine and pleasant, the high 81 to 85. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Your home is safe, or is it? AA Lock, Dock, and Security. The name has been a staple in Ocala since 1985. Do you have the right equipment in place to have peace of mind when you are at home or away? AA Lock, Dock, and Security has the right people to install and monitor your home or business. Call today for a free on-site security analysis. Call 867-1965. AA Lock, Dock, and Security, 219 Northwest 10th Street, 867-1965.
I'm Major George Patterson from the Salvation Army. Please stop by our family store at 120 Northwest 10th Street in Ocala, where on Wednesday you have a 50% off clothing and bric-a-brac. On Friday, 25% off furniture and large appliances. And on Saturday, stop by to our yard sale from 8:45 to 11. Donations can be made by calling 352-732-4469 and we'll pick it up. Funds from the store go toward the services that we provide in Marion County.
What you may have missed on the John Tesh Radio Show.
Talking about ourselves stimulates the brain the same way love, food, and cash do. Everybody's favorite subject is themselves. So, on a date, ask her about herself. Adults studying a new language learn words and phrases faster when they sing them. Normal, happy cows produce about 9 gallons of milk a day. But super relaxed and happy cows produce more than 10 gallons.
Intelligence for your life on the John Tesh Radio Show. Don't miss this stuff.
All right, thank you for waiting. Dr. Ivan Levinrad is here, and Renee Genther is here. Dr. Levinrad is a doctor of physical therapy at Strive Rehabilitation, and Renee Genther is an oncology patient navigator at Ocala Health. Can't underemphasize how important that position is. Leah Corso is also here, but not on the camera. She asked that I not do that today. And Leah is with Strive Rehabilitation and is who we thank for these two wonderful guests. And I'll tell you a story. It's not cancer, but it was the lady we had on the air. She wrote a book. She had been in a terrible, terrible car accident, and her 2 twin baby daughters, were in the car seat, and they survived. They survived. They were okay. She was in a coma for a little while. When she came out, she couldn't walk at all. She said she learned to walk again the same day her babies learned to walk.
Wow.
Isn't that cool?
That's awesome.
Yeah.
And for her, and I guess this is why I'm bringing it to this conversation, is because for her, she had this goal. Look, my babies aren't going to have a normal life if their mommy can't walk. So she kind of made that her mission, you know. Is there a psychological approach that you have to use?
Well, I mean, there isn't a psychological approach. There's a number. It depends on the therapist attitude as well, what kind of personality. But I can tell you now that most patients do not just want to get out of bed and hop around and they're in pain. For example, I work in the trauma unit at Ocala Regional. Patients are banged up pretty much. Patients, oncology patients, as I said before, they're fatigued and painful and they don't want to get up and just hop around. So you've got to talk to them. Sometimes they want to refuse you. But you've got to explain to them the benefits of getting up, the benefits of the rehabilitation, set goals with them, explain to them the plan of care, and you can't develop a plan of care if you can't evaluate them. So they've got to move for you and show you what they can or cannot do.
Right.
So you can set up this plan of care. So there's a number of factors, not just a matter of going there and trying to get into someone's head. It's not just psychology. It's a multifactorial approach of using your skills as a therapist, using your common sense many times, talking to a patient. Just talking and listening to a patient, you can win them over. Far too often in the medical profession, we're so rushed, you don't listen to the patient. So just by sitting down and why don't you want to get up? But if you do this, it's good for you, and so on and so forth. And before you know it, you'll have them eating out of the palm of your hand. You've got to be positive. You've got to find out where their head is at, what their goals are, or maybe you want to help them set up goals. So, I keep on going back. You've got to treat the patient as an individual. There's not one formula that fits everybody. Everybody's at a different stage of physical function, mental preparedness and attitude, and sometimes it takes a team approach. You've got to speak to the fellow medical fraternity, the doctors. Sometimes you've got to go to the doctor or the RN and say, listen guys, I need you to go in there, or the nurse that's treating the patient, and go in there and explain to them, once I've left, the benefits of getting moving and getting active, and so everybody's kind of getting into that patient's head. So you come back the next day and they say, I've had time to think about it, I'll work with you today. Okay, we just go easy. And so then they can get out of the bed. Then the next day, let's walk 2 steps, and it becomes 4 steps, becomes 8, becomes 16, becomes 50 steps. You understand? So it's a very difficult evaluated process, and you come in one day and the patient is gung-ho and they walk well, the next day they take a turn for the worse, or they've just had chemo session, and so they don't do as well. Then they say, I let you down, or I let myself down. No, you don't let anybody down. This is what we expect. Be positive. We do what you can do. Tomorrow we'll see where we're at. You take one day at a time.
Well, see, your approach is much better than like a drill instructor, who wouldn't give anybody any leniency.
Well, but you know what, Larry? Sometimes you've got to have that approach.
Really?
Sometimes you have to have that approach. But sometimes you mustn't have that approach. So, it comes with experience and dealing with these patients, and you listen to the little voice in your head. It's not, as I said, you've got to treat each individual as a different person, taking into account everything that you can.
And you have to have that bonding experience, because maybe you got to have all those different personalities. They need you as their
making
therapist.
A very good point, because very often the doctor will come in and out and spend a couple of minutes with a patient. The nurse comes in there, they're busy, they're spending a little longer with the patient, but they're there 12 hours with the patient over a couple of days.
Right.
So they build up a rapport. The physical therapist comes in, I can be with that patient 10 minutes, depending on how much they can handle, and I can be there an hour. I've been with a patient an hour many times, or 45 minutes every day, sometimes twice a day. If they go to a rehab facility, sometimes it's 3 hours a day they're with therapy. Wow. So you get to actually know that patient, because you're dealing with them on a one-to-one basis for a lengthy period of time, on a daily basis, over sometimes weeks to months, depending on the situation. And so you get to become good friends.
I bet, and I love your personality, so I'd be the perfect patient for you.
We obviously haven't spent enough time together, because the drill sergeant is what you need.
Renee, I have a question. Renee, I have a question for you. Dr. Levinrad is a talented man. I can understand that you must have access to a lot of talented health professionals.
He's right. It takes a team approach.
But do you have, like when you're working with an individual and you say, oh gosh, I know who would be the best for you. Like maybe Dr. Levinrad would be good for Larry. Maybe somebody else would be good for Robin. So you have to also have a bonding with us, don't you, in order to know where to send us?
Oh, absolutely. Actually, I spend at least an hour with each patient in the very first meeting with the patient and the family, just getting to know them. And part of my job is doing exactly what you said, listening. Sometimes you just have to be quiet because they want to go back and start at the very beginning. In August, I noticed this symptom, and I thought it was this. And then, you need to let them talk through that. And as they do that, you get to know their story. I was told a long time ago by a wise physician who was one of my trainers who said, every patient is a story. Learn their story and you'll take the best care of them. And it's true. Even every day, patients have to tell me a story. And that really gets a bonding process going with them so they know that you understand them. And when you take the time to listen, a lot of times at the very end, they look at you and they go, "You're the only one who sat and listened to me."
Oh, wow.
And for
that makes you feel good, right?
That makes them feel better, like, okay, they have some trust in you. And then you can start to work, you basically have laid some groundwork, so you can now start to build on things. And you also know when they do push back, because there's times where you'll have a really great day with someone.
Really?
The next day you walk in and you've hit that mental wall with them, and you can see they've shut down. But having heard their story, you know why and understand. And sometimes, instead of working with the patient that day, I work with the family. Or I find out what the barrier is, and I say, hey, let me make some phone calls for you. Let me get through that. And they just look at you like, thank you.
Wow.
I do some really silly things sometimes. I call and find somebody to watch their dog or check on it. I do anything anything that makes the patient function is my job.
So let me bond with you. My symptoms started yesterday. I had a sore throat. Today I have no voice. I shook Dr. Levinrad's hand, and he's already coughed once in the interview.
Yeah.
I'm so sorry.
You should go home and go to bed and drink a lot of fluids.
Chicken soup.
Yeah.
During the break, Leah had brought up an interesting question to you. Do you take patients that have already been diagnosed and been through some form of cancer treatment? Maybe they're diagnosed and then they're told that they're cancer-free. Then they move down from another area. They can still come to see you.
Absolutely. Survivorship's a relatively new area for oncology. It's been around a while, but it really hasn't been formalized. It's becoming much more adopted. We have 14 million cancer survivors in the United States now. So these are people that really need specialized care. And so patients often move down from up north, like you're saying, because this is Florida. And all it would take is a referral from their primary care doctor or their oncologist. And I would have them just sign some forms so I can get a summation of what their treatments were, and then meet with them, identify if they have any issues that need help, like do they need a referral to physical therapy, do they need to see anybody in our community for further care, and also follow back up with them again to make sure things actually worked, or what the interventions we did actually worked for them. So yeah, anybody who has had a history of cancer, and survivors are patients living with cancer too. And people always focus on the cure, but I'll be honest, a lot of patients now live with disease of cancer almost as a chronic disease, and so they may have lesions or areas they can't get rid of, but they either shrink them away, get them in a remission, or keep them stable. And so some patients live for a decade even in this situation, even longer. So those are still cancer survivors. So you don't have to be through with treatment. You just have to be a survivor, and you're a survivor the day you're diagnosed.
I always picture that walk with the bags with the candles in them.
Oh, yeah.
Luminaries.
Yeah.
Isn't that great?
Yeah. Let's see, we need phone numbers and contact information. Do we go to, Leah, do you want to give us that? Or?
For Strive, it's 352-351-8883.
Okay.
And,
for oncology navigation services and survivorship, it's 352-401-1534.
So I'm still not sure, Renee, are you the first person we go to, or does the doctor send us to you?
I get referrals. I can have patients contact me directly, which I have, and sometimes everything's a phone call. I just kind of help, and it doesn't matter where they're from or who they are, I hope.
That was funny. You said phone call, and I heard a bell.
Yeah, angels are here. Angels are visiting.
But for the most part, I get referrals from surgeons, from imaging centers, and from oncologists themselves. If patients admitted to the hospital, a trauma sometimes contacts me. Patients come in for one thing and they find another. So I'll get referrals from all kinds of places.
Well, thank you, Renee, for coming in. Dr. Levinrad, good to see you again. We'll see you next time, maybe at the racetrack. getting
The yogurt.
A yogurt, yeah, frozen yogurt. You are my inspiration, by the way. I know it's going to be one day. One day I'm going to tell you, guess what I'm using? I'm using that PDF you sent me.
Yes.
Because you sent me a PDF.
Yep. I sent you that jogging program.
Well, maybe I need a drill sergeant. I don't know. Thank you for what you do. I love meeting with you. You're great. I think we would get along.
Oh, absolutely. Absolutely.
I think you can get along with anybody.
You remind me so much of my niece. Don't you think, Michelle?
Yes,
Michelle?
you do.
Thank you. And thank you, Leah. Thank you. All right,
Thank you for having us.
We'll be right back.
In Wu, there's a lot of finger pointing over who's to blame for allowing the second nurse infected with Ebola to take a commercial flight. She claims the CDC cleared her to get on the plane even after she told them she had a fever of 99.5.
Fox News is learning that Amber Vinson may not have been fully forthcoming with